Pasok.
Morning, sir. I'm going to close this door to provide you privacy. I'm Krizza Guinto, a level 1 nursing student from Holy Angel University, and I will be your attending nurse for today. So, to start, sir, may I ask for your full name?
Kevin Lu.
Okay, thank you, Sir Kevin. How about your birthday, sir?
July 3, 2002.
Sir, so how are you feeling today po?
Okay lang po.
Okay, good to know, sir. Moving on, I am here to perform the assessment of your heart and neck vessels and also the peripheral and vascular system to gather objective data that will help me determine if there's any health concerns and the proper intervention for it. So, with this procedure, sir, I'm going to touch some parts of your body and I will ask you to do some things. Would that be okay, sir?
Okay.
Okay, thank you, sir. Rest assured that all the information gathered will be kept confidential. Okay, sir, before assessing you po, I'm just gonna have to ask you a few questions. So, first po, do you experience any chest pain?
No.
Okay, sir. So, do you have difficulty in breathing or shortness of breath?
Wala po.
Do you feel pain or cramping on your legs?
Wala lang.
Have you been diagnosed with heart defect or a murmur po?
No.
Have you had any heart surgeries?
Wala.
Wala po. Okay. Is there any history of hypertension, elevated cholesterol levels, or diabetes mellitus in your family?
No.
Okay, sir. So, do you smoke, sir?
Hindi.
Do you drink alcohol?
No.
How often, sir?
Madala lang po.
Okay, sir. Thank you. So, do you exercise regularly, sir?
Di naman po gano'n. Pero sa work, it's more on physical
Activities, sir.
activities.
Okay, sir. So, that's all, sir. Thank you. So, now po, I have all the materials needed, which are the pen light po, the alcohol, the gloves, and my stethoscope. So, I will just be using this alcohol before putting on the gloves. Okay, sir. Now po, I will be simultaneously palpating and inspecting the precordium area to assess po if there is any visible pulsations po. Okay po. So, I'm just gonna give you this blanket po for draping. Okay. Now po, sir, I'm going to ask you to pull down your shirt. Okay. Thank you. And on the other side, sir. Okay po. Okay, sir. Thank you. Now po, can you pull up your shirt? Just exposing the under chest area. Okay. Okay po, sir. Okay po, sir. You can do it now. Can you pull down your shirt again, sir, for palpation? On the other side, sir. Okay, sir. Pull up. Thank you. Okay po. You can do it now. Okay, sir. Upon palpation and inspection po, sir, there is no visible pulsations po. Also, there are no hips po or lifts. Now po, I will be auscultating the heart in all four anatomic sites, the aortic, pulmonic, tricuspid, and mitral. So, I would be asking you again to pull down your shirt po. Wait for me po. I'm gonna use both the bell and the diaphragm of this stethoscope. So pull down your shirt, sir. Okay. Sir. So pull up your shirt, sir. Okay. Now I'll be using the bell top. Okay, sir. Pull. Okay, you can undo it now. Pull down your shirt again, sir. Thank you. Okay, now I'm gonna ask you to lie down and I will repeat the procedure. I will just pull up the shirt. Okay, sir, thank you. So, upon auscultation po, sir, the S3 and S4 and some murmurs are not auscultated po, sir. Therefore, it's all normal, sir. The S2 po is louder at the base and the S1 is louder at the apex po, sir. Next po, I will be inspecting for your jugular veins for distension po, sir. I'm just gonna ask you to move a bit, sir, so that I can remove this pillow. Okay, thank you, sir. Okay, note po that if there is any distended veins po, I'm going to assess po for jugular venous pressure. Okay, sir. Now po, can you move your head sideward? Thank you, sir. On the other side, sir. Okay, sir. Okay, sir. Thank you po. Okay. Upon inspecting po, there are no visible distended veins po. So, it's all normal and I would not be assessing for a jugular venous pressure. Okay, next po, I'm going to ask you to sit down, sir. Okay, I'm gonna help you. Okay. Now po, I will be looking or palpating for the carotid arteries, sir. Okay. Can you move your head upward? Okay, I can feel it. On the other side, sir. Okay, sir. So, upon palpation po, sir, I could say po that your pulse are equally strong po. Grade 2 po, and there is no variation po of strength from beat to beat. The contour po is normal, and the arteries po are elastic, and there are no thrills that are noted po, sir. Okay, sir. Now po, I will be auscultating for the carotid arteries using the bell. Okay, sir. Okay, sir. Okay, I'm going to ask you to inhale, exhale, hold your breath, sir. Okay, on the other side, sir. Inhale, exhale, hold your breath, sir. Okay po, sir. So, upon auscultating the carotid arteries po, sir, there is no swishing or blowing po, and all I could hear is your pulse, sir. That's all it po for the heart and neck vessels assessment. Now, sir, for the peripheral and vascular assessment, I would be palpating all of your peripheral pulses on both sides of your body to determine po the symmetry of the pulses. Okay, I will be doing it individually, simultaneously, and systematically. Okay, I will just start now, sir. Okay, so, side. Okay, sir, I will just put this down, sir. I'll be touching you here, sir, in your femoral. Okay. Okay. Okay, sir. Okay, sir. The other side. The purple tail. Okay. Dorsalis, pedis. Okay, posterior tibial. Okay, sir. Thank you. Okay, sir. Upon palpation po, sir, all the pulses are normal po in terms of rhythm, strength, and weight po. Also, I have inspected your legs for any signs of phlebitis, and fortunately po, sir, there isn't. So, your leg veins po are barely visible, they are flat po, and they are barely seen under the skin po. Next po, sir, I will be inspecting for your peripheral veins on the arms and the legs po for the appearance of superficial veins po when the limbs are elevated and when the limbs are dependent. So, now po, may I ask po if you could just relax, sir? Okay. Now po, may I ask po if you could put your arm forward? Thank you, sir. Okay, sir, you can undo it now. Okay po, sir, upon assessment, I could say po that there are no superficial veins po on the peripheral veins of your arms and legs po, both when dependent and elevated. Now po, I will be inspecting for your hand and feet's color, temperature, any signs of edema or skin changes po. Okay, sir. May I ask po if you could put your arm forward? Okay. Okay. And put it downward, sir. Thank you. Okay, sir. Upon inspecting po, the temperature of your hand and feet are equally warm po. The color is appropriate and symmetric po. There are no signs of pallor, cyanosis, or edema, sir. Sir, for the final assessment po, I will be doing the capillary refill test. So, may I ask for your hand, sir? Okay. On the other side, sir. Okay, sir. Okay, upon the test po, sir, I could say that your fingernails are pink po. Capillary beds refill and the color returns in less than 2 seconds. So, it's all normal, sir. That's it po for the peripheral and vascular assessment. I will be documenting po this informations and I would also relay this to your physician po. If you are in need of assistance or if there is any questions, sirs, just call me and I will be here. Thank you.
Hindi po.